Hi, I'm Dr. Kathleen Harder, and I'm running for the new Congressional District 6 because I want to make a healthier Oregon. I thought I'd tell you a little bit about myself to understand why I feel so very passionate about the work that needs to be done here. When I was small, we had very little. I grew up in a small apartment above a bakery and watched my mom take in laundry from the factory across town just to make ends meet. My dad was a brilliant but tortured man and self-treated his mental illness, resulting in a downward spiral of addiction. My mom took me from that toxic environment when I was about to go into middle school, and we left with no more than 2 suitcases, leaving the state and starting over. When I was in school, I was painfully shy as a result of the trauma I had experienced before. The teachers that ran into me didn't just teach me, they believed in me. They saw something, I don't know, a spark, but they believed in me enough to give me the confidence to do well. When I was 14, I started working in a clinical lab, and that was when the true science geek in me emerged. That was when I first thought maybe there was a dream of going to medical school and using science on a very personal level. It took me nearly 10 years to finish my undergraduate degree because I worked my way through school. When my daughters were 2 and 4, I started medical school. I remember picking them up in my beat-up 1972 VW camper van from school, dropping them at daycare, and then going and pulling another shift just so I could pay for childcare. I finished my training and I have been practicing internal medicine for the last 30 years. I've been very fortunate to have a fantastic career, and it's because of the people that I have run into over the years that make me really want to help and make this place healthier. I really do look at all the problems through a healthcare lens. I want to make families healthier, communities healthier, and our world healthier. And I think the way to do that is by doing exactly what we're doing right now, is having a conversation and working together collaboratively to get work done. Aside from my career advocating for my patients over the last several decades, I've also worked in the community. I felt very important that I connect with the people that I treat as patients as well. I've run for school board, and even though I wasn't successful, I continued to work within the school district and served on several different district committees, including the facilities committee and the budget committee. And I still volunteer in schools to this day. I also served on the board of Planned Parenthood Advocates of Oregon and testified before the state legislature on behalf of the Reproductive Health Equities Act. I'm immediate past president of the Oregon Medical Board, and I've served on that body for 5.5 years now. The whole purpose of that board is to protect the patients of the state of Oregon, and I'm very proud of the work we do there. So what I want to do now is expand the work, and just as I've been advocating for my patients for 30 years, I want to advocate for the people of this district. I have lived here, worked here, and raised a family here, and I feel very qualified to take the passion that I feel to a different level, to Congress, to work for all the people that live here. I would love your support.